What is stroke? A stroke occurs when the blood supply to a part of your brain is interrupted or reduced, preventing brain tissue from getting oxygen and nutrients. Signs and symptoms of stroke include numbness or weakness of the face, arm, or leg on one side of the body, confusion, trouble speaking or understanding, trouble seeing from one or both eyes, trouble walking, dizziness or loss of balance and coordination, and severe unexplained headache. If you know a person who is experiencing these symptoms, then it's time to call emergency. How do we prevent stroke? We have to lower our blood pressure, lose weight, exercise more, drink in moderation, treat atrial fibrillation, treat diabetes, and quit smoking.
Osteoarthritis. Osteoarthritis comes from the word osteo, which means bone, arthur, which means joint, and itis, which means inflammation. In a healthy joint, it consists of two bones, an articular cartilage, and a synovium. This articular cartilage is what makes the bone frictionless. In osteoarthritis, these articular cartilages degrade, essentially making bone-to-bone contact. Signs and symptoms of osteoarthritis include pain during movement, joint stiffness and tenderness, joint deformity such as Bouchard's and Herberdin's nodes, and bone spurs. Treatment of osteoarthritis mainly focuses on diet and weight loss, regular exercise such as aerobics and hydrotherapy.
Hi, my name is Wine and I'll be reporting for today about cardiopulmonary, particularly in chronic obstructive pulmonary disease. So COPD is the most common chronic pulmonary disorder which is preventable and treatable disease. So it is the fourth leading cause of death that affects 10 million persons, higher rate in males than females. So what are the risk factors of COPD? So COPD is the cause of long-term exposure to toxic particles and gases, which is the environmental factors. Cigarette smoking, indoor pollutants, outdoor pollution, and occupational exposure. The second factor is what we call host factors. It is all about genetics, overlung growth, and hyperactivity of the airways. Signs and symptoms of COPD: productive cough, difficulty in breathing, colds, worse by colds, foggy weather, and atmospheric pollution, and systemic effects such as hypertension. PT management. So PT management objectives are prevent airway obstruction and accumulation of secretion, improve airway clearance, cough effectiveness, and ventilation through mobilization and drainage of secretion. So one of it is pursed lip breathing and diaphragmatic breathing for breathing exercise. The second, what we call segmental breathing exercise, can be done during supine or sitting.
What is total hip arthroplasty? Total hip arthroplasty is a surgical procedure used to remove the damaged sections of the hip joint and replace them with artificial joint to help reduce pain and improve function. What are the precautions after total hip arthroplasty? Never bend forward or straight down to pick up something from the floor with your knees straight. Instead, to pick things up off the floor, support your body with one arm and kneel directly on the knee of your operated leg. Do not cross your operated leg over your other leg. Do not lean forward when sitting. Instead of crossing your leg, and instead of putting more pressure on your hip when sitting, sit with both of your feet on the floor.
Today, let's talk about spinal cord injuries. So what are the causes of SCI? It could be motor vehicular accidents, gunshot injuries, knife injuries, falls, sports injuries, or severe twisting of trunk. Here are some risk-reducing measures. Always wear seatbelt. Wear proper protective gear while playing sports. Never dive in shallow waters. So how to prevent complications? Wear compression stockings to prevent deep vein thrombosis. Do ROM exercises for arms and legs. And do skin care with frequent skin checks.